Hi, it's Dr. Mo here at Fairfax Chiropractor. I want to talk to you about posture. Posture is really important. I'm seeing more and more kids today, 13, 14-year-olds, that are they're losing their curves. I used to see this in 30-year-olds. I used to have patients come in when they were 30 years old and they have beginnings of arthritis. And now I'm seeing it in basically teenagers. Why is that? I think it's a lot to do with computers, iPhones, iPads. All they're doing all day long is their faces into those things, and they're forward and they're playing games. Why is that so bad? I'm just going to kind of draw a picture here for you, and then that way you could see and go from there. So a normal cervical curve is supposed to go like this. It's a backwards C. What I'm seeing now, and again, in 16, 17-year-olds, I'm seeing this. Why this is so important is the cervical curve that's like this, everything distributes evenly, right? When we have this, all the compression force is going into the lower areas. So what we're seeing when these kids are teenagers now is you don't see arthritis in here, but you are seeing the beginnings of arthritis in the lower area, right? In this one, everything distributes evenly. So you got nice and open segments here. This one, you're seeing compression forces. When they become 20, 30, then they're going to see severe arthritis. When before, they'll be 50s and 60s and see this. Another thing that happens in this, you see these teenagers are having headaches, and that's why they're coming in here. The headaches are happening because with this one, the muscle is nice and short, and there's no pull. With this one, you're getting these long extensions of these muscles. So guess what? If you look over here again, their levator-scapular muscle, which is in their neck, starts from here, and it goes down to here, right? So if your neck is going from this to this, you're elongating these muscles, and guess what? They're getting trigger points in here and in here, and guess what? They're getting headaches. And that's the main thing that I'm seeing. I'm seeing so many teenagers in my office nowadays with headaches, and which they didn't have before. So what do we do here to treat it? We basically try to restore that curve for them. Adjustments are great. I mean, that's what I do. I'm a chiropractor, I adjust. But besides adjustments, you need something else. And that is basically start restoring that curve. So what I do is I adjust, I do muscle stem, I relax the muscles. On top of that, I start working on them, and I start getting a device called a Denerol. This device is very simple. They basically lay on this almost 5 to 7 days a week. Almost every day they lay on this for about 6 months to a year. And what I start noticing is their curve starts coming back. The headaches, after, 2 weeks to a month, the headache starts going away. So that's basically the biggest thing we do at Chiropractic Care Center is we start to restore that curve for them. These kids are coming back, and their first thing is their arthritis is slowing down. They're not having the arthritis like they would have at age 30 and 40. So if you're interested in learning more about this, please come on in Chiropractic Care Center, and we'll show you what we could do to help you. You can call us at 703-277-9590. Again, Chiropractic Care Center in Fairfax. Thank you.